collaborations between academicians and industry will expand. So in summary, if I can say one thing, don't let money sway you, although money is very important, but look at the big picture, see what you would like to do from many facets, and then make that decision. And on the opposite side, don't get sucked into academic medicine either, because that may be the only thing that you see. Because you're a medical student, you're a resident, you've had 8, 9, 10 years of academic medicine, that's all that's out there. That's not all that's out there. Private practice is out there. Look at it carefully and make an educated decision between these two. And if you make something that doesn't work for you, nobody says you can't change. Although it's probably a little bit easier to go from academic medicine to private practice, as long as you don't pick up some bad habits that academicians like us sometimes have. But that may be an easier hurdle to cross than going the other way. Thank you so much for your time.
You know, we have folks in the room who saw the last 40 years of medicine, 50 years in the United States. And I think, Dr. Mami, I'd like to emphasize what he just said. No one can have a crystal ball, but the one thing I think our physicians, our older physicians in the room can tell you, the one thing we can guarantee you in the future that will happen is change. Change will happen. It's already happened in the last 40 years. Change will continue to happen. And it is something that more the reason you choose your field you're going into, you choose your lifestyle is a critical decision, because you need to be ready for change. You need to be ready to handle it, and you need to recognize that change may make you more or less happy. So it's really important to choose what you're going to do and be happy with what you're going to do. Dr. Mami showed a nice slide up there. There's a consultant in ophthalmology who's well known, and he did a survey. And he found that it wasn't the ophthalmologists or the physicians who made the most money who were the happiest, and it wasn't the physicians who made the least money who were happiest. It was the ones who were in between, and those were the happiest. And the reason they were the happiest is they gave away, well, many of them, one of the characteristics that they all shared was they gave away what they did for free. They went on mission trips. They gave back to the community in the free clinics. They joined organizations like IMANA. They gave back, they mentored students. They were the happiest and most satisfied in their field. I mean, I found that remarkable. I mean, you know, if you give away what you have and what you can do for free, you feel a sense of reward. And I think it does make you happy. And I think, you know, that his survey showed that. Do you guys, let's leave some time for some questions. Do you have any questions for our panel here?
The philosophy that you should have, as Sharif mentioned earlier, is that you should be proud of what you've done. If you finish your training, you're just as good as the next person. There's no difference. It's just about placement. And once you overcome that challenge of decision making about what you want to do, everything else becomes easy. Going into private practice, you can either join the simple model, be on your own, and be all you can be, or you can join a group and sort of be a little hoodwinked in the sense that you'll get the smaller cases and you may be taking a little bit more call, and it may be a little bit more challenging. But I like to actually follow the model that my dad told me, because I had the same question you had when I started, and he said, well, if you make $1,000 more than you did as a fellow, you're doing good. So actually it was challenging. I started my own shop, put the shingle out front, started taking call, made my own schedule, took a lot of learning classes on how I can maximize my office potential and practice potential, and did it. And you know, there was no money coming in for 6 months and my credit cards were maxed out. But after that, alhamdulillah, it's been good. You have to decide that if you want to pick in surgical subspecialty, maybe you only do laparoscopy, or you only do inguinal hernias, you know, using a special technique, or you only do office-based surgery. If you super subspecialize, you have problems. But if you can do everything, you can be everything. And then setting up, maybe finding a person to share office space with, like a group of medical doctors, which would be the best thing for a surgeon to do. You have internal referral source of patients coming right to you. I did something interesting. I actually joined a group of 7 dermatologists, and that was my model when I came here, specifically looking for that. So I joined a group of 7 dermatologists, and you know, that is a very strong referral source rather than sitting there and starting up on my own and putting a sign in a magazine or newspaper saying, hey, send me your patients. And they automatically start to trickle in, and then you build up your own name and emphasis. I think that joining a larger group, you get kind of lost. Even though that may be the only opportunity in certain areas, you have to think about that too. But we can talk about that a little later too.
I would actually say that being a general surgeon, for example, your cost barrier to entry is actually quite a bit less. You don't need very much in your office in order to start your practice. You can be in somebody else's office 1 day a week, 2 days a week, you sublet space, you borrow their secretary, their appointment scheduling system, because the majority of your work is done in the hospital, in the OR. Now eventually you'll transition into your own ASC and you'll have your own office, and then you'll be the one who's subletting to the next guy. So, but your barriers to entry from a cost perspective, as long as you're willing to take a little bit of entrepreneurial risk, is not as high as it is in other specialties. I think there are several responses to your question. The first one is that income insecurity is very important to all of us, but if we go into something or plan something based purely on financial goals, in the long term we're probably not going to be ultimately happy with what we chose. So I'm not saying that we do something where we're not going to earn money, but if we do something only saying I'm going to choose this specialty because 10 years from now radiology is going to be making so much money, that's why I'm going to be a radiologist, those people are generally not happy in the big picture. Now, regarding what's going to happen for healthcare reform, I mean, nobody knows, but there are certain demographic trends that are you can't question. The population is aging, the population is increasing, so from that perspective, there's going to be more of a demand for our services. The amount of money that can be put in the pot is going down. So where is that going to be squeezed? Either you tell the Medicare recipient that I'm going to cut your benefits down, and that's politically difficult, if not untenable. So that's probably the last thing that's going to get cut. It's easier to basically say that doctors are greedy rich people. Why don't we give them a little bit of a hit? And politically, that is not a difficult thing to do. What they need to think about, though, is that nobody works for free. And if they cut you back too much as you like what you're doing, you will stop servicing Medicare patients. And then they're going to have a delayed political problem. But anything that's delayed in politics is always better than anything that's current in politics. So that's easier to deal with. And I also think that that in general, we've made up for these cuts historically based on increased productivity. At some point, our productivity is going to level off, so there is going to be general reimbursement, take-home salary reductions, and we have to be realistic, and I just don't think there's an answer other than that.
That's a good question. And like Mama said, I think one of the challenges in business is for years, maybe 30, 40 years ago, we looked at when there was more entrepreneurial success, I should say, financial reward and success in the healthcare industry. It seemed that it was good. You're smart, you're intelligent, you go into medicine, you make lots of money, and you live a good life, right? That's not what medicine is about anymore. If that's what you're planning on, don't do it. And for all the young guys who are out there, you know, the reason that Dr. Mann was kind enough to put the plastic surgery things, he's right. Plastic surgery people are usually the most unhappy people. They make lots of money, but they don't really do what they really want to do. And they have specialties. I mean, I do love doing cleft lip and palate surgery. I do none of that surgery in the United States. I get paid $400 to do that surgery. They're very complex people. I'd rather do it for free halfway across the world and get back and maybe do well for them more than anything else you can. If you're looking for financial reward, medicine is not your field. If you're looking for financial reward, you have to have a certain level of business savviness that's outside of the scope of medicine. That's an entrepreneurial activity that's really not even relevant to medicine. It's relevant to who you are as an individual. The whole purpose of this discussion was to show you that outside of the financial challenges, you have to find who you are in medicine, what you want to be as a doctor. Many of us in this community only want to take care of patients day in and day out. We want to see patients. You know, every specialty is different. Dermatology and certain groups of outpatient medicine don't even know where the hospital is. I myself get lost going to the hospital sometimes if it's not an outpatient surgical center. And the challenges are there are those people who love the hospital environment, who love the patient care contact. Some people love a certain aspect of academics. The financial challenges that are going to come regardless. So to answer that question, both of them, I mean, it's very difficult. As far as ACOs working, even the guys who write the ACO that are down here a couple streets off K, having talked to them, they're not exactly sure why they wrote it. You know, they're confused themselves. They don't know. And some specialty fields will suffer. Dermatologists and plastic surgery aren't even included in the group. So we've got to find another way so we can encourage the use of American Express and Visa. You know, but I mean, these are the challenges we have.